Minimum Wage Commission has proposed an increase to the wage of CPI plus 1%. In terms of its actual amount, that would set this new minimum wage at 23 Rand per hour, up from 21 Rand 69 cents. The Congress of South African Trade Unions, that's Cosatu, says this could improve especially conditions for healthcare workers, not healthcare workers, domestic workers, I should say, who only earn some 88% of the minimum wage. To speak about this, we're joined by Cosatu's national spokesperson, Sizwe Pamla. Mr. Pamla, a very good evening to you. Welcome to News at Prime. I wonder what 23 Rand an hour gets you in South Africa, where life has become so increasingly expensive.
Well, that's a valid point. That's a valid point. But when you consider where we come from, the national minimum wage has really lifted something like 6 million people. And it is supposed to be the foundation. We do hope that many employers will pay more than the minimum wage. But what we don't expect them is to pay below the national minimum wage. We have seen companies, for example, I think companies like Woolworths, we have come out and said that, look, not only are we embracing the national minimum wage, but we are prepared to take our workers all the way to 40 Rand an hour and beyond. So that is the kind of positive attitude that we hope many of those employers, especially big companies, will actually adopt. But at the end of the day, when you consider the economy that we have and the serious factors that we have in just creating jobs and saving the ones that are there, this adjustment is really going to make a difference in.
So domestic workers would then be getting the highest per rand increase, shall we say, because their national minimum wage currently is around 19 Rand 10 cents. They'd now earn 23 Rand an hour. But the issue with that industry is there's so many informal arrangements, agreements between employer and employee that it's difficult to enforce and to police, isn't it?
It is indeed. We do have a union called SATSAU. It's not a Cosatu union, but it's a union that we work very closely with, based in Cape Town, and that really represents the domestic workers. We also work with progressive civil society, because there are civil society organizations that are paying a lot of attention in working conditions and lives of domestic workers. There's a lot of work that has been done on the legislative front to really help domestic workers. I think our challenge now is to educate them, is to have those awareness campaigns to make these workers aware of what is available, and also just work with the department to ensure that inspectors, labor inspectors, are given enough resources to really run these workshops. Because as you rightly say, many of these workers are employed by individuals, and some of these arrangements are informal in nature. But so far, the reports that we have seen show the fact that there's been a positive reaction. The UCT, University of Cape Town, conducted a study that many employers have actually embraced the issue of the national minimum wage. Those who cannot afford have applied to the National Minimum Wage Commission for an exemption. So we are hoping, especially because this adjustment was adopted through a consensus, labor, big business, and government. They all endorsed it. Now we hope that all of the social partners work together to ensure that employers comply.
And look, the other challenge, we're all talking about how low 23 Rand is per hour, but the other challenge with 23 Rand per hour is that often when we calculate the increases, it's from such a low base that it would have to be double or even triple what's been agreed to get people to a stage in life where they can afford to cover taxi and bus fares for a full month, to feed their children, to put them through school.
Indeed, which is why when we are discussing the issue of a living wage campaign now, because the minimum wage campaign was supposed to be an introductory part of the campaign of the living wage. Or when we're talking about the living wage campaign, that's why you'll hear us discussing the possibility of exploring a fuel price cap in terms of looking at ways of fixing what is wrong with the fuel price in South Africa. Starting with looking at the road accident fund, that takes a lot of resources to live, and money that should really be paid by innocent South Africans, but it ended up propping up a very corrupt institution. So we want all of that to be done. At the same time, we're talking about comprehensive social security system, where we're looking at ways of supporting many of these people who are at the bottom end of the salary scale. We're talking about national health insurance. We've already had free education. So these are some of the policy interventions that we hope that we brought on board to really ease the burden that many of the workers are carrying. Because, as you rightly point out, on average, a South African worker spends between 12 and 15% of their income traveling to and from work. When you look at the wages that these workers earn, this is not sustainable. But these gradual interventions and increases are taking us where we want to go. We don't have an economy we wish we had, but with the little that we have to make this gradual we have to make this gradual progress, because at the end of the day, we cannot take decisions on what we imagine. We have to deal with what we have.
Something else I wanted to ask you about is to do with the Basic Income Act, basic conditions of employment annual income threshold, I beg your pardon. You're not happy with that because there have been no adjustments made, I believe, from about 2014. Why have those adjustments not been made in so many years, and how does it compromise workers in real terms?
Well, it's the relevant labour market institution that have failed us so far. We've been talking about this for a long time. We've been pushing the Department of Labour, we've been pushing everyone to really make these adjustments. It is compromising workers because this is the amount. Currently, it is sitting at 240,000. So what it does, if you earn below that amount now, then if you are retrenched and you have to get money from UIF, that money from UIF is calculated based on that threshold. If you earn below that, if you earn above that, then you are not guaranteed anything, including overtime. For an example, if you work overtime and you earn less than 240,000, you are guaranteed that your overtime has to be paid. You can go and argue a case and win. But if you earn more than that threshold, it means that you are not guaranteed overtime. You can only negotiate with your employer, but you are not guaranteed that. This talks to compensation fund, it talks to UIF, it talks to overtime, which means it leaves a number of workers who really are left without any protection. Because when you adjust it, let's say you adjust it to 270,000, where we expect right now it should be at. It means that a number of workers, especially with COVID-19, where people have been retrenched, have been seated at home, many of those workers couldn't go to CCMA and access the money that is due to them because they are not guaranteed that because of the threshold that has been kept.
What then can you as Labour, as unions, do to bring about that change that's needed?
Well, we're doing everything. Like I said, we have met with all of the relevant labour market institutions. We have met with the department, we have met with government. And of course, sooner or later, if there's no movement, we're going to have to litigate. That's the only way out of this, because, like I said, it is really eroding workers' gains. It is leaving many of these workers at a time when workers need every assistance they can get. I mean, the unpredictability of the COVID-19 economy has left many workers without an income. Many of these workers now, even when they work overtime, it means they are not guaranteed that overtime because according to the current annual threshold, they earn more than that threshold. So it needs to be adjusted so that many of these workers who are left vulnerable are protected.
Let me ask you a final question. Which industries are the worst offenders in terms of exploiting that lack of change in the income threshold?
Well, just about all of them, really. Just about all of them, including much more developed ones. For example, like the financial sector. Because if there's one thing that we have seen, the financial sector has been one sector of the economy that has grown over the last decade, including under COVID-19. And we still get stories of people who feel that the financial sector isn't really playing fair. So all of the sectors, because remember, it's easy for them to get away with this because they will tell you that you are not responsible for that. So we can only act based on what government has put forward. We are not going to adjust. Of course, in some of these situations, you can negotiate. Other employers are open-minded. They say, look, we can negotiate, for example, over time if you earn more than 240,000.
Sizwe Pamla, spokesperson for Cosatu. Good to speak to you, sir. Thank you for your time.